Hello everyone, I am Shakaina Aquino Maranga and today I am going to perform oxygen therapy administration via nasal cannula return demonstration. Oxygen therapy is the administration of supplemental oxygen to help people with lung diseases or breathing problems get the oxygen they need for their body to function. Supplemental oxygen is indicated for people who have hypoxemia because of impaired oxygen diffusion across the respiratory membrane, hyperventilation, or significant lung tissue loss as a result of tumors or surgery. People who have severe anemia, blood loss, or other illnesses where there aren't enough red blood cells or hemoglobin to deliver oxygen may also require oxygen supplementation. Now, for the preparation phase, the first thing to do is to check and verify the doctor's order. This is done to ensure that we are going to administer the right medication or treatment to the right patient for the correct reason. The primary care provider who prescribes the oxygen therapy will also include or specify in the order the concentration, the method of delivery, and depending on the method, the liter flow per minute. Next, we'll have to perform a respiratory assessment to establish a baseline data if data is not readily available. So what we would want to do is to inspect the color of the patient's skin and mucous membranes, whether cyanosis is present, inspect for presence of mucus or sputum production and impedance of airflow, observe for the patient's breathing patterns if the patient is experiencing tachypnea or bradypnea, which are abnormally rapid or slow breathing patterns. Also observe the patient's chest movement and chest wall configuration. Listen for the lung sounds and watch out for other irregularities. It is also very important for us to determine the patient's vital signs, especially the pulse rate and respiration rate, along with its depth and rhythm. And if diagnostic studies are available, we should also check that, such as CBCs, oxygen saturations, ABGs, X ray results, or pulmonary function tests. Next, we'll have to assist or we'll have to prepare the patient and the support people. First, we'll have to assist the patient to a semi-Fowler's position. For this position permits easier chest expansion, hence easier breathing. Okay, sir, I am going to raise the head of your bed slightly so that we will be in a moderate high back rest position. Okay. After doing that, explain that oxygen is not dangerous when safety precautions are observed and inform the patient and the support people of the precautionary measures they have to follow. Taking safety precautions is crucial when receiving oxygen treatment or oxygen therapy because while oxygen cannot burn or explode on its own, it does facilitate combustion, and more frequently people are unaware of its presence because it does not have a taste, smell, or color. That is why client education is highly significant. Also, precautionary signs saying no smoking, oxygen in use should be placed on the door or on the foot or head of the bed or on the oxygen tank or somewhere where it could be easily seen by everyone, especially by visitors, so they become aware and take caution. So here is our no smoking sign, oxygen in use. Okay, also remind the people or the visitors about these precautions. Okay, ma'am, sir, since our patient is going to receive oxygen therapy, I would like to remind all of us that lighting or smoking cigarettes inside is strictly prohibited. It is against the hospital policy and it is very dangerous because it could cause fire and explosion of the oxygen tank. Also, I encourage you not to use volatile or flammable materials such as oils, greases, alcohol, ether, and acetone near our patient, and our electrical devices such as our phones and earbuds or anything um, that needs to be plugged in should be in good working condition so that Short-circuited sparks are avoided for the same reason that it could cause fires and explosion. Now, for emergency cases, we have our fire extinguishers on standby, and I hope all of us are clear on this, and I thank you all in advance for following this safety protocols. Now, the preparation phase is done. I am going to proceed with the performance proper of the administration of oxygen therapy. Now, for this part, the first thing to do is to introduce myself to my patient, verify my patient's identity, explain the procedure to the patient, why is it important and how he can participate, and discuss the effects of oxygen therapy be used in planning further care or treatment. Good morning, sir. I am Shikaina Maranga. I am your student nurse today. How are you doing? Okay. Do you know where you are? Can you tell me your name and birthday? Okay. Um, so, as per your doctor's order, we'll be giving you supplemental oxygen. We have noticed that your oxygen saturations are quite below normal, and so we are going to try and correct that by giving you oxygen. You don't have to worry, you just have to relax. We'll be using nasal cannula. This procedure, it will not hurt at all. And it will not restrict your ability to eat or speak or to move, but I still encourage you to move more carefully to avoid accidentally removing the nasal cannula that we'll be placing inside your nostrils. Do you have any questions? Okay. After that, I am going to perform hand hygiene and observe other infection prevention procedures to deter the spread of microorganisms and to protect my patient and myself from infection and cross-contamination. Okay, now after doing that, I am going to provide privacy for my client to preserve his dignity and integrity by closing the door or curtains. This will also provide some comfort for the patient as well. Next, I am going to proceed with setting up my oxygen equipment and humidifier. So in healthcare settings, there are two ways in which oxygen can be supplied. It could either be through portable systems such as cylinders or tanks, or it could be through wall outlets. But for this return demonstration, I am going to be utilizing an oxygen tank. Here. So, what first thing to do is to connect the flow meter to the oxygen tank. It should be in the off position. So here is the flow meter. So this flow meter is a device that is used to measure or control the flow of oxygen from the oxygen distribution unit, which is our oxygen tank, to our oxygen user. Okay. If needed, we'll have to have a humidifier bottle pre-filled with distilled or sterile water, depending on agency protocols, and it should be prepared prior to coming to the patient's bedside. So this is the humidifier bottle, and this humidifier will be placed below the flow meter gauge, so that the oxygen will first pass through the water, pick up vapor, and then through the prescribed oxygen tubing of the patient. So this is important because sometimes when we administer oxygen, this could cause drying and irritation of the nasal mucosa. And to prevent that, we have this humidifier. Now, after doing that, I am going to connect my prescribed oxygen tubing and delivery device to the humidifier. So there's a lot of types of oxygen tubing and delivery device, but for today I'll be using the nasal cannula. Okay, so this nasal cannula is the most common and inexpensive type of or device used to administer oxygen. It is easy to apply. It does not restrict the patient's ability to eat or speak. It is relatively comfortable. It permits some freedom of movement, and it is well tolerated by clients. Now, this nasal cannula delivers relatively low oxygen concentration at 24 to 45% with flow rates of 2 to 6 liters per minute. I am now going to connect this tubing into the humidifier. Okay. After having everything connected, next thing to do is to turn on the oxygen and ensure proper functioning. So, the oxygen must be flowing freely through the tubes. There should be no kinks in the tubing, and the connections should be airtight, and there should be bubbles forming or appearing in the humidifier as the oxygen flows through. And you should feel the oxygen coming out of the cannula outlets. Okay, so I'm going to turn on my oxygen and then feel for the oxygen coming out of the outlets to the back of my hand. Okay, and after doing that, after ensuring that it is functioning properly, we can now proceed with um, having the oxygen at the prescribed flow rate. So our flow meter has a ball inside which will float when the oxygen is turned on. So the line for the prescribed flow rate should be in between the ball. So for this demonstration, our flow rate is at 2 liters per minute. Okay, now that we're done setting up the equipment, next thing to do is to appropriately apply this nasal cannula to our patient. So what we are going to do is to put the cannula over our patient's face with the uh, outlet prongs into the nares and the tubing hooked around the ear. So as you can see, or as you can observe, our the cannula outlets has a slight curve in it, so this should be placed into the nares like this. Okay, so proper fitting of the cannula into the nares will ensure correct and accurate administration of oxygen. Okay, sir, I am now going to place this cannula into your nostrils. Okay, after placing the cannula into the nares, if the tubing wouldn't stay in place, we can tape it to the patient's side of the face to keep it steady and secure. And we could also pad the tubings over the areas of the face and the ears to avoid skin irritation caused by friction of the tubing against the skin. And we're done for that part. Okay, sir, so is the cannula comfortable? Is it too tight or too loose? Okay. Um, just relax. I encourage you to breathe through your nose and then out through your mouth so that you can get the maximum amount of oxygen that we are trying to give your body. Okay? And just relax. I am going to stay here with you to monitor your condition. Now I am going to proceed with the assessment phase. First, we'll have to assess the patient's vital signs, level of anxiety, color, ease of respirations, and provide support while the client adjusts to the device. So we should also take note for any signs of respiratory distress such as tachypnea, nasal flaring, use of accessory muscles when breathing, and dyspnea. And then next, we'll have to assess the patient every 15 to 30 minutes depending on the client's condition. This is also done to assess the effectiveness of the oxygen therapy. We'll have to assess the client regularly for clinical signs of hypoxia, of tachycardia, confusion, dyspnea, restlessness, and cyanosis, which if were to happen, we'll have to check first if our oxygen tubing is still connected to our flow meter, or if our flow meter is still at the prescribed flow rate, or maybe somebody stepped on the tubing and disconnecting it to the flow meter, or if our oxygen has been accidentally turned off. Now, we should also check for our patient's oxygen saturation and arterial blood gas results if they are available to monitor if the condition of the patient has improved, remained, or declined. Next, we'll have to proceed with the assessment of the cannula. We'll have to assess the patient's nares if incrustations or irritations are present. So if there is any, we can provide immediate treatment and relief. So looking at my client, I don't see any signs of incrustations or irritations. Next is to apply a water-soluble lubricant as required to soothe the membranes of the patient. So here I have a nasal lubricant. This is for you. We need to apply this to your nasal area so that we can maintain its moisture and avoid irritation and drying. Is it okay? Next, we'll have to inspect the areas of the skin of the patient, especially the ears, for any signs of irritation. So, if there is any, we can pad the tubing or uh, place pads over those areas. Next, we'll have to check on the equipment regularly. We'll have to check the flow rate and the level of water remaining on the humidifier to every 30 minutes or every time we are providing care for the patient. This is done so that we can ensure that we are administering the accurate concentration of oxygen continuously and that moisture inside the nasal mucous membranes are maintained. And then after that, we also should check if everyone, especially the visitors, are following these safety protocols we have just mentioned earlier. And then I am going to perform hand hygiene and aftercare of the equipments that I use to deter the spread of microorganisms. Okay, and then lastly, I am going to document the procedure that I have just executed. This is done to help the multidisciplinary team offer excellent care. Appropriate documentation accurately reflects nurses' evaluations, changes in clinical status, care given, and other important patient information. That is all for today. Thank you all for listening and watching. I hope you all have a good day.